Ага, спасибо большое. Good morning, or good afternoon, dear students. I'm glad to see on the lecture. Please, will say me good afternoon in the chat. Да? For understanding, it's necessary for understanding who is present now on the lecture. If you can hearing me, can see multimedia presentation, please write down in the chat good afternoon, your name, group. Okay, and we'll write down the chat. Can you hearing me and can you see me? See, not me, see multimedia presentation in your ecran. Okay, okay, please connect, dear students. We'll call your friends. Lecture now will start. Today will be an interesting topic. Lecture about diagnostic technologies in rehabilitation and sports medicine. Okay, dear students, connect, please. Faster, and we will start lecture. Okay, I can see some students attend, but many students absent. Please connect as soon as possible. As soon as possible. Now we will start. Okay. No, I hope rest students will connect fast. Okay. Today we have second lecture, Diagnostic Technologies in the Rehabilitation and Sports Medicine. On previous lecture, we have conversation on lecture discussion, the topic of physical and medical rehabilitation. You understand what is rehabilitation medicine. But how about sports medicine? How about sports medicine? We will discuss today, and we will discuss diagnostic technologies in the sports and rehabilitation medicine. The main task purpose of lecture to generate at students a representation about participation evaluation for sport, functional tests used in the rehabilitation and sports medicine. You can see on the illustrations the questions which we will discuss today on lecture. Life, what is it? Only structure and biochemistry or moving too? We will give answer on this question on today's lecture. What is medical control and sports medicine? You know, physical training, sports activity is very, very important in modern world. It's prevention disease, it's good mood of person who involved in the sports activity. It's many positive effects, but dear students, sports activity can be useful for person only the case when its sports activity is rational, is optimum for person. For different person need different type of physical activity, should be personalization of physical training. These questions study um, sports medicine and medical control. It's obligate part, physical training, obligate part of sports activity. Medical control, it's independent medical discipline studying influence of physical exercise and sports on health, physical development, and functionalities of sportsmen, and generally on human organism. Medical control, together with physiology, biochemistry, biophysics, sports traumatology, cardiology, endocrinology, makes new branch and knowledge, sports medicine. On this illustration, you can see the sports can be useful and give strength, good endurance, good mood, good quality of life, but can be harmful. Can be harmful if it's sports um, not optimal physical exertion. Medical control. Physical training can induce positive changes in the human organism, functional and morphological. Physical training together these physical factors base of today physical rehabilitation in all branches of clinical medicine. And you understand why we will connect two branches of modern medicine, sports medicine and rehabilitation medicine, because this direction in the medicine connect with each other very strong. Incorrect forms and types of physical training can induce functional and morphological disorders and disease, prepathological, pathological conditions, and unfortunately, non-rational physical training can be reason diet of athletes. If you're hearing on the TV or any news, the young, strong athletes died during physical training or competitions, it's dear students result as usually non-rational physical training. Physical training need medical control for prevention this negative complication. How about organizations of sports medicine? All athletes who participate in the collegiate athletic scholarship or walk-on must have passed a physical examination from a licensed physician prior the issuance of athletic department equipment. Dear students, all pre-participation for sport must pass medical examination. Why? Because the sports medicine, it's scientific discipline, brain general medicine, which study diagnostic, treatment, and prophylactic disease. For effective prophylactic, the disease among of athletes and participation for sport. Who is participation for sports? It's person which going to be athlete, going to start physical training. They will pass medical evaluation. It's obligatory part, preparation for sports activity. You can see now on the picture the special form, medical evaluation, pre-participation for sport, uh, athlete, or this form also can use for provide in medical examination patients during medical rehabilitation. First of all, physical rehabilitation. You can see in this form same stages in the medical evaluation as in other clinical discipline, in this surgeon, therapy, and other. But there are some big difference which is specific for sports medicine and medical rehabilitation. No, how you remember that first stage in the medical evaluation is passport data. Next stage, it's complaints. Um, uh, if anybody have complaints who going to be athletes, participation for sport for athletes, for example, have complaints, headache, maybe any seizures, lost consciousness. In this case, it's contraindication for any physical activity, sports activity, of physical rehabilitation. In this situation, we must uh, send this patient to the specialist, neurospecialist. No, in this case, it's neurologist. You understand? Before start uh, any sports activity or physical rehabilitation, we must provide um, strict diagnostic condition of pre-participation. Uh, okay, next stage in the evaluation, it's anamnesis of morbi. You remember, ask about when start disease, what's some treatment use, and such array. Next, you can see also on the disc card stage in the evaluation is anamnesis vitae. We must ask, as in other clinical discipline, about first of all, infection disease which person had before. If person have had before, for example, or have now the open form of tuberculosis, understand it's contraindication for any sports. It's indication for treatment in the physiatric department. And in these situations, physician who take on yourself the role of sports physician or provide medical rehabilitation should uh, send this person on the adequate treatment. Or, for example, have COVID-19 new coronavirus infection. Same situation. You must remember about this. There are limitations for physical training for person with hepatitis B, C, and other. This situation must be consultation of gastroenterologist, contraindicate for any sports, but for exercise therapy, recommendation should be after consultation of gastroenterologist. Understand this, or infectionist. It depends from situation. Some moments about diet, about other disease. When we recommend for person sports activity or medical rehabilitation, physical rehabilitation, and first of all, the exercise therapy, we must know about disease which have this person. If person have, for example, diabetes mellitus, or maybe hypertonic disease, in this situation, shouldn't recommend for this person intensive physical training. Why? Because it can provocate acceleration of this disease and complication in person. We must remember about this. For example, if person in the anamnesis have any trauma, for example, fractures of spine, then in this situation we must recommend physical activity which prevents exacerbation, complication, this disease. Not, for example, for this person will be the best sports activity connect without gravity exertion, accelerated gravity exertion on the spine will be very good. Swimming, for example, and other. How about operation? Operation. What if person, for example, in result of operation, nephrectomy, have one kidney? How about sports activity in the sports medicine? We must recommend kind of sports which will be not dangerous for this person. Limitation, not recommend contact sports. Understand why? What is contact sports? Contact sports, it's sports where high risk of trauma. High risk of trauma. Okay, next, bad habits. Bad habits. If person have bad habits, for smoking, drink alcohol, drug abuse, narcotics using. In this situation, no, and first of all, if haven't any seriously complication, we should recommend person stop smoking, drink alcohol, use narcotics, because it's very dangerous, you know. And smoking, it's high risk of chronic bronchitis, COPD, cancer disease sometimes. Drinking alcohol, reasons of encephalopathy, dementia, polyneuropathy, cirrhosis of liver, and many other problems. Using of narcotics, same situation, can be reason different psychiatric problem, dependency, also dementia, problem with heart, myocarditis, and this person very fast died in result of complication using of narcotics. But if combine using drug, narcotics, doping with intensive physical training, increased risk sudden cardiac death. Understand, it's very dangerous. We must recommend stop using this harmful chemical substance. Okay, what is specific for sports medicine? We must ask about sports anamnesis. Which kind of sport person have training before? Maybe about sport qualification. It's help us in the diagnostic different complications sports activity, and for recommend adequate optimum physical training. On the card you can see other part of the investigation, in the medicine, sports medicine, in the physical medical rehabilitation. It's determination of physical development. All peoples are different. On this picture you can see three types of constitution of people. It's asthenic, normosthenic, and hypersthenic. It's depend from gene polymorphism is base of anthropometric polymorphism habitus. For recommend adequate exercise therapy, adequate sports activity, we must know about specialty particularities of physical development of person and patients. Provide investigation anthropometric profile. What's include this? It's determination weight of body, determination body mass index, determination of height, circumflex of chest, should determine during investigation physical development strength of muscles, provide hand dynamometry. You can see B, it's basic dynamometry determination in the first situation, strength muscles of forearm and hand, other it's strength muscles of extensors of back, and also provide spirometry for determination vital capacity and functional reserve of respiratory system. After this, in the investigation for use visual inspection. Visual inspection, now I will come back to the card. How provide visual inspection? Look at person, preparation for sport or athlete, or patients without clothes. Look at up from down, from external to internal, determine condition of skin, mucous, lymph system, adipose tissue, muscles. Look for hernia porta stage. Understand that if in the sports medicine determine hernia, where should determine hernia? The most often localization hernia, it's abdominal, paraumbilical area, it's inguinal area, and also okay, look at the conditional of back, conditional of thoracic cavity, the shape of lower extremities and foot. How about back? That can determine different deformation of spine. In the frontal position, it's will have name scoliosis. If it's provide too much in the place of physiological curve, normally in the spine there are physiological lordosis, physiological kyphosis. It's normal, but if haven't kyphosis, physiological and lordosis, it's also very bad for biomechanical situation during movements. Also, not positive situation, not as positive situation, when person have hyperlordosis, excessive lordosis, or excessive kyphosis, hyperkyphosis. In this situation, we shouldn't recommend person during sports activity, physical rehabilitation, exercise which connect with gravity exertion, axial gravity exertion on the spine. You must remember this. During assessment conditional of food, we can determine flat food, can determine normal food. That you can see on this picture. Normal food have norm arch. That flat food have flat arch or haven't this arch. For diagnostic, use methods plantography. Very simple methods. You can do plantography at home and determine your condition of your foot. Necessary will paint your foot. For example, black color, and step on the white sheet of paper and receive print from plant for food, and determine if will be incisor in this picture. It's usually normal food. If haven't, it's flat food, and provide determination determination of the angle which appear after draw vectors in this incisor. Okay, after external examination, provide physical examination as usually. Now use palpation, percussion, auscultation, check reflexes, all organs and systems. All organs and systems. As therapeutics determine borders of heart, lungs, the character of respiration, heart activity, palpation, pulse. As neurologists check conditional of nerve system, check conditional of skeletal muscle system, investigate range of motion in the different joints, determination conditional of muscles, etc. Also provide investigation as ophthalmologists determine the conditional of visual analyzer, as otolaryngologists check conditional of hearing analyzer, as surgeon check conditional of health of person for reveal surgical disease, as gynecologist for review gynecological problem, disease, etc. That should provide investigation of organs and systems. After that, if determine any problem, for example, arrhythmical pulse, or maybe enlargement of liver, and any should provide additional investigation. ECG, X-ray examination, maybe echocardiography, maybe CT scan, MRI investigation. It depends from situation, labor test, and other. After that, there are next step in the medical evaluation in the sports medicine and also in the rehabilitation medicine, it's providing of a functional test. You can see on picture muscle work um, connect with work of cardiorespiratory system and neuroendocrine system. We can assess the status of human body organism, and if we provide investigation cardiovascular and neurohumoral system. That you can see for this use different functional methods. The ECG, reovasogram, capillogram, electroneuromiographies, EEG, determination of different level of hormones, determination neurological status. That but dear students, um, there are latent pathology, which haven't any manifestation during rest. In this situation, for us can help special diagnostic test with physical exertion on medicamentous test, which provocate a human body organism and can help reveal latent pathology. It's problem on quick evaluation. These tests help us quickly determine conditionals of organism, the different functional. It's have named, dear students, this test functional test. It's is the best methods for quick integral evaluation on functional status. Another name, dear students, this test is stress test. Stress test. Functional test evaluate general reaction of human organism after physical work. General reaction provided by all systems, cardiovascular, respiratory, endocrine, nerves, etc. Why is necessary using of functional test in the rehabilitation medicine and in sports medicine? Dear students, functional test, stress test, help physician in the determination in, first of all, latent disease. What is latent disease? It's disease which haven't any manifestation during rest. If we will use for rehabilitation person, treatment person, physical exertion, exercise, or recommend sports activity, and didn't determine this latent disease, it can be a reason of disaster. Now I will explain you why. For example, any person have decision will be athlete, that will be strong, beautiful, and start physical training without medical evaluation, without providing of a functional test. For example, we'll run, run, but this person have um, latent ischemia disease of heart, form of angina pectoris first functional class. Dear students, if you remember from classification, angina pectoris connect with exertion. Person with angina pectoris exertion first functional class have manifestation disease after 900 meters for fast walking or climbing on the fourth floor. It can be pain in the chest, can be breathlessness, but, dear students, many people having this terrible physical exertion in the modern life. Why? Because have work with computer, have rest nearly TV, with any gadget. To work can use, as usually used, a car or maybe marshutka or bus, autobus. In the building, use elevator and don't have this physical exertion. But during start physical training, physical exertion, appear symptoms of angina pectoris. Person, if haven't medical educational and knowledge about this disease, think, oh, maybe it's standard normal reaction on the physical exertion and will continue running, for example. And what happened next period of time? PhD students, infarction myocardium. You know, first ischemia, but if not normalized blood circulation, not decrease exertion, appear infarction myocardium. Result of infarction myocardium. 15-20% died. Rest patient who survive have invalidization. This person will be handicapped after sports activity. Do you understand how it's important provide this correct diagnostic technology in the sports medicine? Same situation with medical rehabilitation. If we don't know the tolerance person for physical exertion, we cannot recommend adequate exercise therapy. We must know about physical capacity, ability person do any physical exertion. We provide functional test also in the rehabilitation medicine. All functional tests divide on the subgroups. It's respiratory test, Stange, Genchi, Serkin test, test with change of position of body, orthostatic, clean orthostatic test, test with standard loading, example, Martinet-Kushilevsky test, the Letunov test, test for determination physical work capacity, step test, treadmill psychoergometer test, Harvard step test, test with change of cast structures, hypoxemic test, and a medicamentouse test, which help in the also in diagnostic different disease. For example, now previously situation now how we can diagnose ischemia disease, angina pectoris, if we will give the person nitroglycerin and during this test provide ECG, on ECG, person with ischemia disease of the heart, angina pectoris, we determine change interval ST during ECG. Over is the line or under is a line. After take nitroglycerin, ischemia disappear and ECG normalized. It's proved person have ischemia disease of heart, have angina pectoris. Now, example, medicamentoso test. Okay, now more detailedly about this test. As usually, the principle of functional test, it's evaluation of reaction different system. No, and first of all, now we discuss a basic functional test for respiratory system. Stange and Genchi functional test. How should do this test? We must determine time of delay of breath after deep maximum breath. Normally, it should be 40 to 60 seconds and more, dear students, that more. The athletes with good physical capacity, good qualification, can stop respiration, delay breath during 5-10 minutes. No, many factors determine level of Stange test. It can be tissue mass, effectiveness of the gas exchange in tissue, activity of enzyme, and so on. As usually, we provide evaluation function three system. It's respiratory system, understand first that, how provide gas exchange. Next, it's blood system, and others, cardiovascular system. Next is Genchi test, functional test. It's time of delay of breath after maximum exhalation. Exuded is background of quit breath is measured. Normal level test is 25 to 30 seconds, but can be more. That with some athletes can be until 2-3 minutes delay respiration. If will be situation, dear students, when result during this test will be less than normal. It's possible when person have any disease. It can be disease of respiratory system, cardiovascular system, or blood system, anemia, anemia, for example. Its express test give to us ability determine the different problem with respiratory, cardiovascular, and blood system in the person. It's a very simple test. You can very widely use this test in your clinical practice. Not need special equipment, only timer. watch or clock. Okay, next, functional test for reaction of cardiovascular system and autonomic nerve system. Now about orthostatic test. It change of body position from horizontal to vertical, distribution of blood downwards, deterioration of venous return to the heart, compensation with increase of heartbeat. Results, norm after verticalization, pulse rate that should increase 10-20 millimeters of mercury. On this picture, you can see special variant of verticalization, which can use in the orthostatic test. It's necessary for patient during medical rehabilitation, physical rehabilitation, who long time cannot stand up. After orthostatic test, also increase systolic blood pressure. Systolic blood pressure. You can see different variants. Diastolic blood pressure normally, as usually, shouldn't change. Systolic blood pressure increase on the 15-20 millimeters of mercury. Other test, it's clean orthostatic test. Transition from position of standing in a prone position. If previously test, we check functioning of cardiovascular system and sympathetic department of autonomic nerve system. Why? Because process activation of heart activity, vasoconstriction, release from sympathetic nerve system. Now we will discuss clean orthostatic test, which also can ability determination function of cardiovascular system and parasympathetic division of autonomic nerve system. You understand, after lie down, pulse delayed on the 610 beat per minute. Blood pressure also delayed, also decrease blood pressure on the 10-15 millimeters of mercury. It's norm, dear students, but can be variant which be abnormal if we now have conversation about orthostatic test. If person have any cardiovascular disease or parasympathicotony, deficit in the regulation of sympathetic nerve system, after stand up, blood pressure not increase and can fall down. Pulse rate also can increase more than normally or not change. It's pathological reactions. Proved person have any disease, cardiovascular, autonomic nerve system, or person have pathological condition of athletes. Now we have conversation about athlete. Or have bad fitness also. But last variant, bad fitness, we can determine this diagnosis after a strict clinical examination of this person with use additional methods of investigation, ECG, echocardiography, maybe CT scan, and other um, labor test. Okay, how about clean orthostatic test? If we determine receive abnormal result, it also can be manifestation any disease, heart disease. Done first of all, it can be hypertension disease. You understand, if person have hypertension, latent hypertension disease, which provocate change position of body, this person during sports activity, during physical rehabilitation, can have different complications. Brain stroke, for example, on infarction myocardium. That we must remember about this, and also provide strict clinical investigation and remember about this during recommendation physical rehabilitation. Okay, next test, Harvard step test. It's test necessary for determination physical work capacity. For this test, not necessary specific expensive equipment that can use scale step. For men, it's half meters. For female, 43 centimeters. Test time 5 minutes. Person should step climb on the step. Step speed 1 step per 2 seconds. You can see illustration that use this functional test. Up step, down step. Now, instructor must to measure pulse rate during 30 seconds after start, second, third, and fourth minute. It will be pulse rate F1, F2, F3. After this, use the formula. Provide calculation. T, its time of test, 300 seconds. Multiply on 100 and divide on the F1 plus F2 plus F3, multiply on 2. And receive index Harvard step test. Now it's example how provide calculation during this test. And receive result. The Harvard step test indexes. If it's less than 55, it's very bad physical capacity. 55 to 64, bad physical work capacity. 65 to 79, it's middle tolerance for physical exertion. 80 to 89, it's good physical, tolerance for physical exertion. And more than 90, excellent physical work capacity. No, you can see it's also depends from constitution of person. Different variant of step test. It's example. Okay, next step. Next test with standard physical exertion. It's have name Martinet-Kushelevsky test. Test with 20 knee bends during 30 seconds. Should check parameter of blood pressure in the sitting position and pulse rate before test and after test. On the first, second, third, fourth minute. How long time should check pulse rate and blood pressure. Until the pulse rate and blood pressure recover to normal, to parameters before physical exertion, 20 knee bends. You can see graph of test, how normally change pulse rate, blood pressure, systolic and blood pressure, diastolic. Can be different variants, reactions on the standard physical exertion. Can be normotonical type, can be asthenic or hypertonical type, hypertonical type, dystonical type, and scale type. No, normal is normotonical type. Pathological types, it's hypertonical type, dystonical type, scale type. No, and asthenical also not very good. Normally, when person is healthy and have good tolerance for physical exertion, after 20 knee bends, pulse rate increase not more than 60 to 80%. Pressure increase not more than 50%. Pressure, diastolic pressure not change, systolic, repeat, increase not more than 50%. Diastolic pressure not change or small decrease, maximum is 5 millimeters of mercury. Restoration time, after physical exertion, when all parameters come to parameters before physical exertion, blood pressure, pulse rate, as usual, 5 minutes. Asthenical or hypertonical type, pulse rate increase 100 and more %. Pressure not change or small increase. Pressure systolic. Diastolic blood pressure not change or small decrease. Pulse pressure not change. Restore time, it can be 5 minutes, but can be more. Each type can be in the person, we can determine the person with hypertonical disease or person with asthenia, period reconvalescence after disease. Hypertonical type, pulse rate increase 100% and more. Sharper increasing of systolic pressure, 160 to 180% and more. Pressure, diastolic blood pressure can also increase 10% and more. Pulse pressure increase. Restore time can be 5 minutes and more. As usually, these reactions have person with hypertonic disease. Also, I will say abnormal result on the Martinet-Koshilevsky test can have athlete with pre-pathological condition. It's overtrain, overstrain. You remember I said about this, about clean orthostatic and orthostatic test. Same situation with Martinet-Koshilevsky test. Abnormal result can have person with athletes with pre-pathological chronic overtrain and overstrain. It's very important to remember. Dystonic type of reaction. Pulse rate increase 100 and more %. sharp increasing of systolic pressure, sharp decreasing of diastolic pressure, sometimes to zero level. Pulse pressure increase. Restore time as usually more than 5 minutes. It can be in result of disturbances of venous valve system and any other anomaly of heart system problem with autonomic disorders also can give this problem. No, and prepathological condition of fatness, I repeat also. Scale type. Pulse rate increase 100% and more. Pressure increase with maximum on the second, third minute. Diastolic pressure decrease. Pulse pressure increase. Restore time 5 minutes and more. It's also pathological types of reactions. Can be the result of disturbances in regulation system hemocirculation, overdose of physical training, psycho-emotional and physical stress. Dear students, after only one type of reaction, normotonical, athletes may continue physical training or can start physical training. Then observe asthenic or on-off pathological reaction. Sports physician or person or physician physical and rehabilitation medicine must stop or change form of physical training or not give ability for physical rehabilitation or sports activity. Pathological forms of reaction in the indication for deep clinical investigation, additional clinical investigation. Forms of cardiovascular system reaction to physical work depended from general status of human organism, level of physical work power, equivalence between power of physical work and physical ability of organism. And you understand how it's important to recommend for person adequate optimum physical exertion during the sports medicine, in the rehabilitation medicine, for achieve the maximum positive effect for health of person. Okay, physical work capacity, functional test for determination physical work capacity. Functions of dependency physical power from pulse rate, headline type only before pulse rate level 170. It's now we have conversation about test PWC 170. PWC is physical work capacity 170. It's maximum level of pulse rates which we can use during this test. How we can relieve this functional test? Use cycloergometer, maybe treadmill, maybe scale. What this test is usually provide with using of ECG and very widely used in the sports medicine and also in the rehabilitation medicine for provide correct physical rehabilitation person with cardiovascular system. Uh, During physical exertions, cycloergometer or treadmill take off the ECG, provide ECG investigation. You can see on the picture the variant of manifestation ischemia of myocardium. This test obligatory use for rehabilitation person with ischemia disease of heart. It can be post-infarctional myocardium rehabilitation, can be rehabilitation patient with angina pectoris, and the level of physical exertion depend from result of ECG investigation during physical exertion. Now you can see we must give physical exertion and checked result of ECG. If find first figure, please can see, it's horizontal depression of the ST segment in subendocardial myocardial ischemia. Figure second, it's depression of the ST segment in subendocardial myocardial ischemia, sagging through shaped. Figure 3, it's oblique depression of the ST segment in the subendocardial ischemia. Figure 4, it's key ascending ST segment depression associated with subendocardial ischemia. Figure 5, it's elevation of the ST segment associated with subepicardial ischemia in the unstable angina pectoris. Figure 6, pronounced elevations of the ST segment associated with transmural ischemia with spasm of the coronary artery provoked by physical exertion. Figure 7, the rise of the ST segment above the scar zone associated with myocardial asynergy. When we look for and find these changes of the ECG, we must stop physical exertion and determine the pulse rate during this physical exertion. This result we can use for recommendations, the threshold for physical loading during physical rehabilitation. Starting of ischemia, it's indication for stop physical training, and physical exertion shouldn't be more than this pulse rate. And during physical rehabilitation, medical rehabilitation we must control pulse rate. During test, PWC 170 test, we can determine different variants of heart rate disturbances during exercise test. It's also indication for stop physical exertion and for determination the optimal dose of physical training. Test PWC 170 recommend World Health Organization for widely using in the sports and rehabilitation medicine. Technology of test. For person, as usually give two physical exertions with physical powers W1 and W2 during 5 minutes with break time 3 minutes. Instructor fixed physical powers W1 and W2 and parameters of pulse rate F1 and F2. And calculate that and calculate after that. Normally, the parameter test PwC 170 for men is 120 to 180 watt or 2.8 watt on kilogram. For female, it's 75 to 125 watt or 2 watt on kilogram. Sportsmen, as usually athletes, have more parameters, more than 200 watt. It's more than 4 watt for on kilogram. Many scientific investigations show strong correlation between parameters of physical work capacity test and parameters of health, dear students. Then more parameters of physical work capacity, less morbidity in the person. That its parameter connect closely, have strong correlation with somatic health of person. If person have physical capacity less than normal, should be suspicion person have any diseases used for diagnostic. And opposite situation, if we use sports activity or medical physical rehabilitation for increase physical capacity of person, we improve somatic health of person. You can see the formula for calculate parameters of PwC 170 test. Example calculation. PwC deeply correlate with every important biological physiological process. It's have name utilization of oxygen in organ and tissue. Utilization of oxygen we made to evaluate and directly to measure by level of maximum oxygen utilization or maximum consumptions of oxygen, MCO. Maximum consumptions oxygen basic parameter characterized functional ability of cardiovascular and respiratory system and general physical ability of human organism. MCO unit is milliliters of oxygen on kilogram per minute. You can see the biochemical reactions when use oxygen for receive energy, ATP, for physical work with production of CO2. And you remember now why it's necessary. Oxygen person during physical work. And understand then more ability for consumptions of oxygen, more physical work, more intensity person can do. There is strong correlation between maximum oxygen utilization, MCO, and power of physical work. It's illustrated this parabola on the graph. So you can see difference of MCO on the different biological taxons. The best results MCO have butterfly. In the clinical practice, use two groups of maximum consumptions of oxygen measurements. First group, it's direct circle ergometry with gas analysis. You can see on the first picture. And indirect circle ergometry or step test without gas analysis with determination of pulse rate. Direct method. Gas analyzer calculate quantity of oxygen and carbon dioxide in expired and inspirated air during physical exercise with maximum level of physical power. Result during this investigation is volume of utilized O2 oxygen, VO. Only two additional parameters, body weight M and test time T, and formal maximum consumptions of oxygen equal the volume utilized oxygen divide on the body weight and divide on the test time. More simple methods, more comfortable for determination maximum consumptions of oxygen is indirect method. Needed parameters during measurements. It's pulse rate, body weight, gender, sex, physical work capacity, and test time. Determination of maximum consumptions of oxygen provided with using of nomogram of astronaut. You can see this nomogram on the picture. The maximum oxygen utilization of these parameters have norm in the different age category, and these parameters are different for men and for women. You can see on this table for person from 20 to 29, men norma it's 44 millimeters per minute on kilograms. For women, 36 milliliter per minute on kilogram. In the age category from 30 to 39 years old, its parameter for men 42, for women 34. In the age category from 40 to 49 years old, normal for men is 39 millimeters per minute on kilograms. For female, 33 per minute millimeters per minute on kilogram. In the age category from 60 to from 50 to 59, it's 36 millimeters per minute on kilograms for men, and for female, 39 milliliter per minute on kilograms. Its parameters, dear students, very important to know. Why? Because they connect with somatic health of person. If it's abnormal parameters, less than normal, which you can see in this table, it's proved person have disease, or maybe very soon uh, will receive disease. It's indicator problems in the human body organism. These methods use for diagnostic somatic health of person, and also for correction somatic health of person in the sports medicine and also in the rehabilitation medicine. The main task rehabilitation procedure in this situation is improve maximum oxygen utilization. For this use different methods of exercise therapy and physiotherapy. Now you can see main factors that determine MCO. It's muscles, types of nerves activity, hormones, and all people divides that on relatives classification that on aerobes and anaerobes, and you can see different levels of hormone thesis types. The anaerobes have small, less than normal. The parameters is usually MCO. Aerobes normal or more than normal. And you see, can see difference and the endocrine status. It's disease that can be connected with problems with parameters on MCO, the utilization of oxygen. Okay, dear students, thank you for attention. Good luck. Please remember the using of functional tests in the sport and rehabilitation medicine help us in first of all, review latent disease, help in the recommendation optimal physical training, exercise therapy, help in the evaluation effectiveness of process, training process in the sports medicine, rehabilitation treatment process in the physical therapy rehabilitation medicine. You understand, if parameters of physical capacity, parameters of MCO after training improve, increase, it's good. Now we recommend correct form of physical training. If parameters MCO physical capacity not change or decrease, it's help us understand necessary change the tactic and strategy of physical training or maybe medical rehabilitation. Okay, thank you. Goodbye. Good luck.